So I have mentioned in previous videos about how treatment can help and how health services, etc. can deal with mental health issues. Unfortunately, we are not living in a fairy tale world where the only outcome is a happy ending. And today I'm going to cover a bit on the failings that I have experienced myself. Once again, especially this time, I can't stress enough how subjective this video is. My experiences are not necessarily the norm. I may have just been unlucky in a lot of cases, but you can't ignore the fact that there does seem to be a long list of failures, at least by the NHS, to help those suffering with mental health issues. See, as I've mentioned, when I first really got to the point where I accepted that I really needed help and realised that it wasn't a sign of weakness to get it, I went to my doctor and said, look, I'm depressed, I'm anxious, there's a lot going wrong in my head, can I get help? First thing they did was prescribe me antidepressants. Now, I'm not going to criticise that. If someone comes in saying they're depressed, there is a chance it's just a short-term issue and a course of antidepressants will clear it up and fix the problem and everything will be hunky-dory again. Yes, I did just use the words hunky-dory. So I'm not going to criticise that they prescribed me some antidepressants, and I tried them. They briefly helped me ever so slightly. I think that may have been a placebo effect anyway, but I felt a little better in the short run, and then they stopped working. So I went back and I said, look, I'm feeling depressed and terrible as I was before. Is there anything else we can try? So they tried another one. And I took those, gave them a try. Again, maybe placebo, maybe not, but it did feel like it was helping. And then it stopped. It was, it's either it was placebo and I'd given up on it, so I'd lost faith in it, so it stopped working, or it was working and I'd built up a resistance. I do have a resistance, it seems, to various medications. Annoyingly, a lot of those medications are painkillers. Yeah. And, painkillers and anaesthetics. So you can imagine how fun it was when I broke my leg in a car accident and I got into hospital and the morphine did practically nothing to ease my pain. They may as well have been injecting me with saline. But that's a story for a different time. So anyway, yes, I went back to the doctor and said, look, these have stopped working. What else can we try? And they tried me on another one. The last one I tried was it was either citalopram or sertraline. It was a selective serotonin reuptake inhibitor anyway. And so I tried those, and a couple of days into the course, I actually basically suffered from serotonin toxicity, which is occasionally fatal, so I stopped taking those and went back to the doctor again and said, look, this really isn't working. Are there any other possible treatments? And it was at that point they decided that therapy might be an idea. So the process then was they sent me to see a gateway worker. The process has since changed then for some people, and it's a slightly shorter process on occasion. But this gateway worker basically is someone who sees you and assesses you and sees if the therapy system can help you, if there's anything they can do to help. And I saw her and she said, right, yes, I'm pretty sure there's something we can do. The most likely is cognitive behaviour therapy. But first we need to get you to see a psychiatrist to actually get a diagnosis. So I saw this psychiatrist, and I'm going to be honest, he didn't know his arse from his elbows. I've not done a lot of study into psychology and psychiatry, but at least I'm aware of what cognitive dissonance is, where you feel conflicting thoughts on a subject. Because I explained to him that there are times when I feel high and happy, and at the same time there's sadness, an element of despair and depression in there, which I now know is, in bipolar disorder it's known as a mixed episode. In other conditions it may have a different name, it may be the same thing, but either way, it is a known situation where you can feel high and low at the same time. And he had no clue what I was talking about. He said that it wasn't possible to feel that way, in spite of the fact that it is well documented. But bear in mind, this is the same psychiatrist who a friend of mine told me the anecdote, because they went to see him as well, and they were told that their situation was because of traumas in their past life. Now, I do not disparage belief in past lives. I'm open to the idea. I'm not sure I believe it, but I am open to the possibility of it. But scientifically, on a psychiatric level, you look for causes in this life, not previous ones. So as you can imagine, I lost a bit of faith in him. I did end up seeing a different one who... before I stopped seeing, he did diagnose me with bipolar disorder, which, while I do seem to fit some of the bills with that, there are more that I don't. Another one has said that it's more likely to be, I don't know what it's called now, but it was borderline personality disorder, where basically my emotions are unstable and can run rampant. That does seem to fit a lot better with me. I do seem to have more volatile emotional reactions, which doesn't mean I get angry easily. I mean, I can, but that's not what it means. It means that my emotions can go in any direction very, very easily, and when they do, it can be an exaggerated response. Anyway, they did end up sending me to cognitive behaviour therapy, saying that it is the most likely to help me, which, for anyone who doesn't know, is basically retraining your mind in various situations so that it doesn't react with an anxiety response, or doesn't react so strongly with an anxiety response or a depressive response or an unwelcome, unnecessary emotional response. And so they said when I went there that there was a bit of a waiting list, and sure enough there was. I was told there would be about 12-week waiting list, 12-week wait before I got seen. And it was 4 months later that I got a call to initially assess me for entry into the cognitive behaviour therapy. By that point, I had actually got myself into a temp job, and so I couldn't make it. So the waiting list had actually cost me my spot. I ended up having to live with the situation I was in for a while until, again, it got too much, and I had to go back and say, look, this was after the temp job had ended, and I was back on the tightrope of life, waiting for something to happen. But yeah, I went back to the doctor and I said, look, I couldn't make it to therapy last time, can we try again? And they said, yeah, sure. Because I'd already been through the gateway, it had changed so that I could go back, just basically refer myself to them, call them up and say, I need the CBT, can we do the telephone triage? And so I did, and they did, and they said, right, yes, it looks like CBT is going to be your best bet. There's going to be a bit of a waiting list. Well, again, it was about 3 or 4 months later. This time it was closer to the 12-week, I think. I got my appointment, so I went there, and I had the CBT, and that was when it was actually... I mean, I already knew that I had OCD at this point, but that's when it was official, and I started receiving treatment for that. It was established that the OCD may be the cause of many of my problems, so they treated exclusively that, even though, again, like I say, generalized anxiety disorder, panic disorder, and dispute between bipolar disorder and... what is the name for that? 2 seconds. Oh yeah, there we go. Emotionally unstable personality disorder is what they call it now. And oh yes, interestingly, in spite of all these diagnoses, what was I being treated for? I was sent there for depression to treat that, which was decided there is likely as a result of my anxiety. It's not purely that, but I'm not going to pretend that it's not at least in big part that. Anyway, I received this treatment, and yes, it did help. It did help me very much. Like I say, I became able to manage a normal life. I got another job, which, as I mentioned in my last video, fell through because of a colleague's insensitivity. And after that insensitivity, which is what sent me back spiralling down into nothing, I've tried again. I have been to them and asked for another round of cognitive behaviour therapy, which I was told that I could do any time. I could just get straight back into the system. And again, they gave me the numbers to self-refer, so I did. I called them up. They said, they ran the triage and said, right, yes, okay, we'll get an appointment out to you. There's a bit of a waiting list. It'll be about 12 weeks. And so I waited, and I waited, and I waited, and while I was waiting, I developed what felt like a swelling in my throat. So I went back to the doctor with this, who said, well, I can't see anything, but we'll send you for an ultrasound to check on it. And so I went to the hospital, and they did an ultrasound on my throat, and they did find a growth on my thyroid. The sonographer, I think that's the correct term, said that it was a small one and was probably benign, and told me to go back to the doctor to ask about it. And so I went back to the doctor, and they have said that they're not going to do anything about it. They're not even going to investigate it more. That was their actual words, that we're not going to investigate further because it is small and most likely benign. And you can imagine that I've been feeling this every day since it started. For a while, it was constantly feeling like it was getting bigger. It doesn't seem so much like that anymore, but it is always there. I can always feel it. Occasionally, it's slightly more noticeable than other times, but that may just be down to sensitivity in the area. It may be down to more. I had to fight tooth and claw for them to look any further, and I was told that what they would do is send me to have a oscopy. I don't know the specific type of oscopy, but basically a camera down my throat. But they did openly say that this would be to show me that there is nothing getting in the way of my breathing and swallowing, and as such, no further action would be taken after that anyway. And I decided to go ahead with it anyway. It turns out that because of my resistance to anaesthetics, the spray they used to numb my throat so that they could get the camera down there didn't work, and my throat still spasmed every time we tried to put the camera down my nose to get it down my throat. So they weren't able to see anything there. They weren't even able to look in. And I have been to the doctor with it, and I have been told that the lump in my throat is a result of my anxiety. They've not said it's a possibility that it's a result of my anxiety. They have stated categorically that it is a result of my anxiety, and it is known, I have looked into it, yes, the lump in the throat is a potential symptom of severe anxiety, and it's known as the hysterium globus, or globus hysterium, or something along those lines. But because I suffer from anxiety, and this is something I'm experiencing, they have decided that is the cause, categorically. No other option, no other possibility, in spite of the fact that they have seen a growth on my thyroid. So I'm basically living with this thing that may or may not be serious, and basically, because of my anxiety condition, they are not taking me seriously. And it is on my record that I have been diagnosed with a chronic condition. That chronic condition is my anxiety. So every doctor I go and see, every specialist I go and see, they look at my notes, sufferer of anxiety. Basically, they see that as, oh, well, let's tell him it's that, let's fob it off. Or at least that's the way it seems. That's the way it's all coming across. But while all this was going on, I was still waiting for an appointment with the therapist for the CBT. And it was about 6 months after I'd initially requested it and had the initial phone triage that I received a letter saying that there are slightly longer waiting lists than expected for the CBT. Please get in touch if you still feel you need your appointment. At this point, I gave up. I've given up on the system because of the way I feel it's failed me. I sent an email back to them because they said, please phone us, send us a letter or an email if you feel you still need your appointment. I sent one back to them saying, at this point, I feel the system has failed. I will not be needing an appointment. And it was about 3 weeks later that I got a letter back saying, because you have not contacted us, we have assumed you no longer need an appointment, and your case has been closed. So it's lucky that my message was saying I don't need the appointment. How many people have been in touch with them saying, yes, I need this appointment, and received a letter saying, because you haven't contacted us, we've closed your case. I'm going to be honest though, I do need that appointment. I need that help, but at this point, I've given up on any faith that it's going to do me any good. Sorry, I'm feeling a bit raw. I didn't expect to remember this quite so vividly, and quite so vividly how it made me feel, how just piled on the depression and made me feel like I was being seen as a burden on the system because, hey, look, someone with mental health issues, we obviously can't help them. Just tell them that it's the depression, it'll get better, and go away. And sadly, I'm not, I know, the only one who feels they've been let down like this. There are stories all over the internet, all through the papers, all on the streets about people who needed help with their mental health from the medical system, and they've been let down, they've been ignored, they've been fobbed off. I'm not going to go into the politics of why it's happening, because there are faults all over the place. There are too many nurses and doctors and professionals and psychiatrists who are trying to do their best and just haven't got the resources that they need. So basically, everyone is being let down by everyone else, and no one seems able to do anything about it. You regularly hear stories from various sources about how people are on the streets because of mental health issues. Someone who's ended up losing their job, and as a result of that, they've turned to alcohol, and as a result of that, they've lost their place to live, and they've ended up on the streets and in a dire situation. And our system, our legal and healthcare system, if they find someone drunk on the street, they take them into the police station, and they spend a night in the cells, and then they're moved on. By accounts, a few of them are offered help for alcoholism and mental health issues. I don't know what the actual proportion is. It may be all of them. I may have heard wrongly, but from my admittedly probably questionable sources, it's not as many as need the help are offered it. So we're basically in a country that can see the mentally ill as a burden on society, as someone to be fobbed off and pushed into the shadows so that the people who can be helped can get help. And after all that, this is not to say that if you feel bad, don't bother with the health system. Go to them. Go to your doctor. If you're feeling depressed, go to your doctor. If you're feeling anxious more than you should be, go to your doctor. Seek help. Get help. There is a likelihood it will work for you, but there is a chance that you may end up in my situation where you lose all faith in the health system and basically just try and go it alone. But you miss 100% of the shots you don't take, so if you don't look for help, you're definitely not going to get it. I've gone on long enough again, and I've probably been more depressing than I intended to. Certainly dredged up a few things that I thought I'd managed to suppress a bit, so I apologise for that. I guarantee that I've missed something that I meant to say, so I'll try and cover that in a future video, and I will see you guys next time. Bye guys.